Hi, I'm Kayla. I live in Raymond with my husband, my 3 young children, and my mother, who is considered in the high-risk group for contracting COVID-19 or coronavirus. I've asked Kathy, our health officer, to join us today to talk about COVID-19 and answer a few questions for me.
Hi Kayla, I'm glad I could meet with you today.
Thank you. Kathy, how is the virus spread and how am I most likely to be exposed?
That's a good question, Kayla. The COVID-19 virus is fairly new, so we're learning as we go. But we do know it's spread mostly from person to person through respiratory droplets. It's a respiratory disease. So when you talk, when you sneeze, when you cough, you can infect somebody else.
What are the best ways that I can protect myself?
You need to protect yourself and your family. Number 1, go outdoors when you can. Sunshine helps along with fresh exercise. You should wear a mask when you can no longer social distance and stay away from high-risk activities.
Can you talk about the different types of face masks? When I go out shopping, I see all kinds of different types, from cloth masks, surgical masks, or contractor type masks.
There are different types of masks. We do have fabric masks. We also have surgical masks, and of course, healthcare providers wear N95 masks. You can wear what you're most comfortable with, but it's important to wear it properly. You should make sure that it covers your nose and your mouth completely. The mask is there to protect others from your germs. So do your part and wear your mask.
What are the most common symptoms?
The common symptoms are fever, shortness of breath, chest pains. You can have body aches, some nausea and vomiting. For some people, it feels like a mild case of the flu. For some, they're asymptomatic. And because you're most contagious before you come out with symptoms, that's why this disease spreads so quickly.
What do I do if I have signs and symptoms of COVID-19, or I think I may have it?
First, you should call your PCP or your doctor. Don't go directly to their office, but call them and get their recommendations. If you have mild symptoms, you may be able to just stay home and take over-the-counter meds. If you do have severe symptoms, such as shortness of breath, trouble breathing, chest pressure, then you should call 911.
If I have to call rescue, what should I expect when they arrive?
If you think you need an ambulance, then you call 911. Our dispatching center is going to ask questions about the COVID-19 virus to give the rescue crews a heads up on if we think we are going to have a patient that is potential for COVID. So your rescue crew is going to come with proper PPE, personal protective equipment. They may have a gown on, they may have a Tyvek suit on, goggles and gloves. This is to protect them because if you do have COVID, they need to be protected.
Can anyone get a COVID-19 test?
Yes, now you can get a COVID-19 test, but first call your PCP. Some test centers are open in Maine. Some of them are by appointment only. Some of them you need to be showing the signs and symptoms before you can get tested. But call your PCP and they will make the recommendations for you.
What happens if I test positive for coronavirus or someone in my household does?
If you're in close contact with somebody in your family that gets a positive test, then you all must go into quarantine. Quarantine for at least 14 days or 4 days after the signs and symptoms are gone. It's recommended that if somebody in your family does test positive, then the rest of the family also get tested. But you need to quarantine and stay home. That doesn't mean going to the grocery store or anything. You're in strict quarantine until you've had a negative test.
Thank you for sitting down with me. I know this has helped answer a lot of my questions, and I really hope it's helped you as well. Stay tuned for more upcoming videos by the Keep Raymond Healthy initiative.